Hi, I'm Jeff Forster. I'm the lead pastor at Heritage Church. Our main campus is in St. Heights, Michigan. And I just want to welcome you to another episode of A Doctor's in the House. And the purpose of our show is to provide a local and global perspective on the coronavirus pandemic from medical doctors and scientists and community and thought leaders. And so we're very excited about today's episode. If you're watching on Facebook during the live broadcast, you can send in your questions using the comment section below. So make sure you do that. And at the end of the program, we'll try to take as many of those questions as we can. With us today, as usual, we have Dr. Bisham Singh. He's joining us from his office. And I want to thank you for taking time for joining us today, Dr. Singh.
Thank you. Pleasure to be here. As always.
Oh, I just was getting a message from my production assistant, so sorry about that. As always, whenever you join us, we always bring on a guest as well. But before we introduce the guest, I just want to remind our viewers that Dr. Singh for a while held an administrative fellowship at the DMC and continues to work tirelessly to improve healthcare here in the States and globally. Also happens to be a candidate for the U.S. House of Representatives for Michigan's 10th District. So you can get more information on him and his campaign and all of the different things he's doing in the community at drbishamsingh.com. We'll put that up on the screen for you, drbishamsingh.com. So Dr. Singh, why don't you introduce our guest today, and we'll jump right in. We have some really great questions and a very interesting topic today.
Sure. So, as you know, for the last month or so, since COVID really was doing its number in our country and globally, I diverted a lot of my attention to actually looking for resources. Several episodes with you, looking to get masks and protective gear for our first responders and for our citizens. And so, throughout our journey, Melissa, we partnered up, has an interesting program where Melissa, and I'll let her introduce herself and tell you a little bit more about it, but they do produce for the first responders. They are one of the best in the country right now. They diverted all their attention to help on the need for this group. So with that, I'm going to introduce Melissa Ackerman. Melissa, welcome.
Hi, thank you so much for having me. So my name is Melissa Ackerman, and in traditional times, I work with other companies to get produce to the back of the house. Many times those are bigger companies such as like a Cheesecake Factory, Noodles, and Tropical Smoothie. But when this began, I wanted to try to use our expertise for good. And my husband is an orthopedic surgeon. So I decided that what I wanted to do was try to use the skills that we had to get boxes of produce in the hands of those that are helping us in this fight against COVID. So what we did was we used our network of 70 plus vetted produce distributors, and we started in Chicago and we moved to DC, and now we are working our way through the nation. And we take our refrigerated produce trucks, we pull up alongside the hospitals, and we are getting 200 boxes of produce at a time to the hands of the workers in the hospitals, the frontline workers. And these boxes of produce can be 20-ish pounds. And they are taking these boxes home to their families or to use at home to recover and nourish and be ready for another shift. So while so many people are doing wonderful things by bringing meals into the hospital during shift, this is another step to try to help those tired workers prepare for the next shift. And they take these right into their cars and they bring them home to rest up and get ready for the next day.
Oh, that's great. That's fantastic. So when you say that you're able to take those boxes to the doctors and nurses and whatever, you also mentioned before we came on the air, sometimes some of the other forgotten people. Can you talk about that just a little bit? Because I love this idea.
Yeah, so after the first time when I did this, I said, we really want to get these to the to the frontline workers. And since it was only 200 boxes, and hospitals can have, we're working with some hospitals that have 27,000
Wow.
employees. So to be able to get that kind of produce, that would be a huge fundraising campaign. So they try to see who could we get this to. And hospitals said to me, sometimes there's the unsung, unforgotten. So some of the janitorial staff, the environmental staff, the security guards, the people that are there working tirelessly, putting their lives on the line too. And so they're not always in the news. Those people also have been sometimes the ones chosen for these boxes to bring home to their families.
I love that idea. The nurses and the doctors, they're front line and they're laying it on the line every day, but sometimes we forget about all the rest of the support staff. And the reality is a lot of the support people aren't as highly resourced. So to be going through this, putting in the long hours, being away from their families, and having access to fresh produce is a fantastic idea. The other benefit too, and you mentioned this, was the fact that they don't have to go to the grocery store after a work shift. Talk about the physical and the health benefits of that.
Yeah. I think that, I don't know, I'm here in Chicago, but to get the Instacarts and I was talking to somebody and they said they have the inns in some cities to get reservations when times are normal at any restaurant, but to score an Instacart reservation right now is like a golden ticket. Right. So I think that this is also helpful for people to get not have to go to the grocery store. And this is just another step of being able to go home, rest. To be honest, in this video I did, when we were talking to some of these people, they said they hadn't had fresh produce in almost 2 weeks, just because they were too tired to go. And it was just, they were grabbing food that was available, and produce wasn't a part of it. And nourishing these people and giving them the vitamins they need, the vitamin C and all the other vitamins that are going to help protect themselves, is so important. So it goes hand in hand. And the more we can do, I just think the better we're going to be able to protect those that are protecting us.
Absolutely. And Jeff, one of the things too, what Melissa's doing is, look, when these first responders finish a day's shift, the first thing on their mind is to get home, get showered, get changed. They're not thinking of going in the supermarket where they've been exposed or in any capacity. So in this way, as they finish their shift, a box is put in the back of their trunk or in some capacity, or they can pick it up and check it in and head home. And it's so nice that you don't have to do that extra bit, that extra shopping. You have a box of some basic necessities that can actually make your day go wow. It's a small step, but it means a lot.
Right. And then, as Melissa already referenced, how difficult it is to get any of the delivery service, whatever. I think you were just mentioning you had some trouble today getting some groceries.
Well, yeah, where I was, Instacart wasn't working, so I'm not fortunate. And but I did call Walmart, and I'll tell you, it's like 3 weeks in the waiting schedule to actually go and pick up groceries. They come in, they bring these little containers, and then they load your groceries in the back of your trunk, and then away you go. So it's become a logistical nightmare, and I think it's going to just get worse if some things don't change.
Well, one of the interesting things that's happening through this crisis is how many for-profit organizations like yours, Melissa, that serve very important industry, restaurant industry. You mentioned Cheesecake Factory. I can't imagine hardly any more essential organization than Cheesecake Factory. But when all of a sudden their needs for produce and all those things drop off, it would be tempting maybe sometimes to just sit back and go, oh, well, our customers don't need our stuff. But then instead you pivoted and decided in a creative way, how can we then use these supplies to serve other people? And the reality is that's keeping some of the supply chain in order. There's a whole bunch of producers that are going to need to unload what they have, and you're providing that connection. And I love the creativity of your organization. What was some of the thought process behind how you guys decided to do that, and how quickly were you able to pivot from supplying restaurants to moving into the other organizations?
Yeah, I think this is just one example of how our trucks can be mobile food banks. And to be honest, this is just one thing, but we really can do this in a big way. And I think you'll start seeing this more and more with the food service distribution, because this is one side of it. Retail, in most instances, is a separate supply chain. So we have that capability. And as you mentioned, and I know that there's been articles recently about this, there's so much that there's shortages in one area, but then so much surplus in the other. So just seeing how we are able to pull up to the hospital with these trucks, this could be in a bigger way in so many areas. And so this was one thought process that I had to help those that are helping us, but also to demonstrate that produce distribution arm could really be an answer to a bigger problem that we're seeing with some of this bottleneck.
That's fantastic.
Right.
Dr. Singh, I know that a lot of your focus over the last several weeks and months has been trying to serve the frontline leaders and workers with PPEs and all those kinds of things. Matter of fact, we've done a couple of episodes about being able to purchase masks and those kinds of things at heritagechurch.com and on your website, drbishamsingh.com. So then this is a natural thing for you to move on from the mask and things, which I want to come back to and talk a little bit more about. But is this something that we're looking to be able to bring into the state of Michigan? And is this something that our viewers be able to participate with?
Sure. So right now, Melissa and I have been looking at hospitals that in the area. So I've got Riverview and Physicians Healthcare Network. So there's a group, already 25 boxes that are already dedicated to one area, and maybe another 30 in another. So we're trying to, obviously, if they got to come in, they have to request it, and then we'll provide it. And so they can go on the website, and they can go to Melissa's website, which will be on my Facebook page, and it will probably be on Heritage Church and as well as Melissa. So in Michigan this is kind of unique. It's organized in Michigan, so I'm in charge of the Michigan area. So any funds that you guys put towards, it's going to go towards these boxes, and so there's an X amount per box. So whatever you do, whatever you donate, it goes to a box that's served. And if you wanted to serve in Michigan, you can request that. And so we're getting ready to actually start helping our first responders this week on that. And so that's something that came in and it was added. And we're so blessed to have Melissa do this, really.
Oh, that's fantastic. So then how much does a box cost again? Can you remind us?
It's $25 a box for the produce.
And $25 for one box. And you mentioned what kind of food is in there and how much? I mean, is one box enough for one family, or is it going to be one box per person?
It's a box per healthcare worker, but it's about 20 pounds, I would say, of produce. So they'll get in there about bananas, oranges, apples, grapes, strawberries, onions, carrots, celery, lettuce. It's a little bit different per distributor because it could depend on the type where they are in their city, but it's a good amount of produce.
Wow, that's fantastic. So then people would be able to get information on Melissa's website, and then also our website, heritagechurch.com, and yours, drbishamsingh.com. And I think that that's an interesting opportunity maybe to serve people. We've mentioned many times at our website, we know that there are people who are stuck at home and want to make a difference and don't know how. And so on our website, we have a place where you can click Give Help. And we also have a place you can click Get Help. So if you're sitting in a situation where you need help, our food pantry, I think this weekend served almost 100 families with enough food for the whole week out of our church. And that continues to grow as more and more people need it. And then, so if people need help on a residential level or on a personal level, we want to help them. But then if they'd like to give help, they can give $25, buys a box of food for our frontline workers, which is fantastic. They can drop off donations for, the food pantry can happen there at Heritage Church as well. And then also we can purchase N95 masks. And those masks right now, our pricing is coming in wholesale. Our price is coming in at like what, close to $5?
Close to $5. And so $50 would get you, X amount of masks. And so, And so we really need to set a time frame on that, because the
and you can explain better, the prices are changing all the time. Can you talk about that?
The demand, like for example, Europe just asked for 1 billion masks. France got 200 million. So it was France that got it, and so the European Union 200 million. So there's large quantities that are just buying and taking, and so you have this global. And then of course Africa is coming in, and so from the International Monetary Fund and the African Fund, they're buying it. So they're just, the demand is just so high. And this is where the cost is, these guys are just, they're not selling 50 masks per box anymore, or 100. They're selling, the minimum order is 500,000. So we have to be able to piggyback with other groups to buy these masks, okay, so that we can get the order in.
And I know that you've been working not only for Michigan, we've been trying to work through that with the governor's office, but with other countries and even other states and other cities.
That's great.
So keep up the good work on that. That's incredibly important. And I was just reading about production. 3M, I think, said they only made 20 billion last year, 20 million, something like that last year anyways. And so everybody's having to ramp up their production in order to be able to provide supplies. Do you believe that it's coming very quickly, that it's not just going to be a recommendation, but that they'll require us to be wearing masks? I know one question that had come through is, hey, it looked like some guy got pulled off of a bus in Philadelphia because he wasn't wearing a mask. Is this going to become a requirement over the next several months?
I think so. I mean, obviously, the requirements was not to wear it before because of touching your face and trying to adjust. And they've showed that the respiratory droplets and just speaking and all this, the droplets can actually go beyond maybe even 6 feet. So I think once we start stabilizing and you see these new cases dropping by maybe early next month, you're going to start seeing as I think for the next 18 months from what the White House has been saying, and even the opposition parties, they're saying that, look, we're here for the long haul until the vaccine comes along. We are going to be wearing some type of protective gear, even when we go shopping or when we're communicating outside of our home. And so we think that the masks will be here with us for a while, or any type of face covering. That will be like, whether it's homemade or whether it's one of these masks from 3M or a surgical mask or like the N95. We're going to be wearing these masks for some good time.
Well, then let's keep going at it and bringing in more of those things, because our people are going to need them, and so we want to be able to provide. So if you're interested in donating to help buy more masks for our frontline workers, then they're roughly $5 a piece right now, and we're partnering with other people to be able to do the same thing and be able to provide those locally. Now, what would be really cool is if we'd be able to provide food and masks together. Maybe put an extra mask in each of those boxes of food. My daughter-in-law works at a local hospital here in the Beaumont system, and some people put together some little kits and delivered a couple of N95 masks to her just to say thank you. And what a blessing that was to her. Yeah. Because there's a limited number available on her floor. And so for her to have a couple of extras just gave her an extra round of protection, so it was good.
I actually went and asked physicians what their needs were. And the other day I got a text from Jen, who probably will come on a show in the future date. There were 15 docs that needed masks that maybe are in the private practice or in, so it's just like, we need help. So we're still compiling that. We're still working towards this. What is the need? And so we're trying to provide that for these groups. Right now, I have two friends of mine in neurosurgery, a neurosurgeon and a thoracic guy. Both have had COVID and both have been hospitalized. And so they didn't do the touching. They kept their distance, but still they maintained to catch this virus. So I think that at some point, and this is day 14 for some, so we're kind of monitoring and trying to follow their progress and just keep them in your prayers when we in the country for this. But at the end of the show, that the fact that these masks may be with us for a while, because of the fact that we don't know how the exposure is, other than touching, and hopefully it might be just from these respiratory droplets. It might be elsewhere. So we're looking carefully at this.
Wow. Well, this looks like it's going to be something that sticks with us for a while, the need for those masks. And that brings me to a question, Melissa. I would imagine that this service that you're able to provide to hospitals and frontline workers and things is probably going to be something that would be an ongoing thing for you while we're not allowed to congregate at restaurants. So how long do you anticipate? Are you hearing anything with regard to how long you need to ramp up the infrastructure to be able to manage this for? Is it going to be days or weeks or months for you to be providing food to the frontline workers?
I mean, your guess is as good as ours, but we're going to do it as long as we need to. And we're working on our other side of our business outside of our foundation to be able to provide this to the general public as well. So we're really working on, the whole figuring out the new normal in general, because I think, as we've said, it's getting the fresh produce to those that need it. And I think at the end of the day, as much as we're getting it to the front lines, the whole public is really in need.
Oh, that's fantastic. That was one thing that maybe our viewers would benefit from. So your organization has the for-profit side and then the foundation side. Was that already set up ahead of time? Did you already have?
Yeah.
Are you already doing good charitable work in the community?
Yes. So the Produce Alliance Foundation has been in existence for 5 years. And it really has been, this is probably the biggest thing we've ever done with it, but it's been, so Produce Alliance is made up of 70 plus distributors, but we've used the foundation in times of need. So like when there was hurricanes, when there was anything that's happened to any one of our members, like when there was the hurricane or floods, we come together as an organization and we use this foundation to help anyone in need. So the fires, the hurricanes, I mean, we've used it for 5 years to help all of our distributors in different ways.
Oh, what a great idea. So really, you said it's 70 organizations that come together through this alliance to be able to distribute their resources in places that is needed the most. And they're doing that on a charitable level through the foundation. But then you're also looking at an opportunity maybe to be able to provide these kind of resources to just normal consumers as well, household. So maybe your wait time would be less than 3 weeks to get shipped. Is that right, Bisham?
Yeah, that's what we're working
on now.
Hopefully maybe I can come back and share some of those things that we have in the works one day.
Oh, that'd be great. That's a fantastic concept. And again, small businesses and medium-sized businesses are the backbone of America. And so to be able to keep those producers and those distributors and shippers and all them, keep them going is a great thing, rather than having all that loss because it just sit on the shelves and rot, and it's a perishable item. So what a fantastic concept. So Dr. Singh, we've had a couple of questions come in, and if I can pivot to those right now.
Sure.
What are some of the challenges that you're seeing, any new challenges that you're seeing at the hospitals?
Okay, so reported by friends, obviously you had Michelle here, you had different physicians. Those challenges haven't changed. So again, beds opening up. It's mostly bureaucracy. So, for example, there are some hospitals that are full, some of them are empty, and some of those hospitals are actually anticipating a need. So they're saying, okay, well, we need these beds just in case. And so there needs to be greater coordination. I think that's the key one. I think the hospitals are doing a great job and trying to manage things. But I think we need some greater coordination at the top.
Yeah. I just recently, I've heard multiple times, the CEO of Beaumont Health Systems was talking specifically about that sometimes the wait in one hospital in the emergency room might be several hours, and the hospital just down the road, that it might only be 30 minutes or so, but because the state government hasn't figured out very well a good communication system, sometimes people are having to wait for a very long time to get served when just down the street. Part of that is the economics of the for-profit hospitals, right? That they're not communicating or whatever. But right now, what you're seeing is more and more of the hospitals coming together and cooperating. And now we just need somebody to be able to communicate better how that's going. I agree with you on that. So there's another one. Here's a question that came in. If our local store is out of masks, are bandanas or fabric, that you have in your house, are those effective? And I think the word effective is the key issue there. I'm not sure if they're asking, is it effective to prevent catching it, or is it effective at stopping other people? So you want to speak on that?
So obviously the most effective mask out of the three, the N95 mask, I mean, that's the one to let particulates inside It will prevent you from coughing, sneezing into other people. So you would prevent those respiratory droplets outside. But if you have COVID-19, you should not be out and about. You should be quarantined at home. So that's number one. I mean, but you'd say you didn't know that you had it, and so you're wearing this bandana. Actually, the White House the Surgeon General had an episode, which I've actually put on my my Facebook, and how to make your bandana, your face mask, even if you didn't have one. It's quite interesting to see him make that. But I think at some point it does confer some kind of preliminary protection, but it's not foolproof. The best way to not get this virus is to stay home for now.
If an N95 mask can help prevent you from catching the virus if somebody's sneezing or coughing on you, but a bandana or something like that can help catch your cough or your sneeze and prevent those particulates from moving out and infecting somebody else. Is that
it would
there's a benefit to wearing a bandana, but it wouldn't be about preventing the disease in you. It'd be about preventing you spreading it to others.
It would reduce it. It wouldn't eliminate it. It would reduce it significantly. The openings of those, if you look at the fibers of the bandanas, they still can allow microscopic. This is an invisible enemy, remember. So it's very tiny, and so I think the best way it does provide some protection, but it's not foolproof.
So here's a controversial question that came in, and I've heard this once or twice. And so I'll ask it in a generic way, but this Facebook viewer mentioned that they heard about a grandmother who passed away and did not pass away from COVID-19, but the nurses said it was likely that she would be reported as a COVID-19 death because of the lack of funding, and this was the best way to get more funding. Are you hearing any of that in places that it's being over-reported?
No. Not to my knowledge. If you had a underlying comorbidity, if you had a underlying comorbidity, diabetes, let's say, or sarcoid, and then or heart failure, and you contracted COVID-19. So at that point, and you die from COVID-19, but not the heart failure, you would be deemed a death related to COVID-19. And not from the heart failure or not from the diabetes. Okay. So that's how they're classifying this.
Okay. So having an underlying morbidity,
right,
and COVID-19,
right,
they claim that COVID-19 killed you, even though you've had this long-term health issue in the past. Because I think the question that some people have been asking is it true that hospitals need to pad their numbers because they can't get extra funding during this hard time otherwise? So
no.
You don't feel like that's a necessary thing, at least not widespread?
No, it's not. That's news to me. They have to test them. You can't. That would be fraud. So you would be able to classify that person contracted COVID-19, actually died of COVID-19, and the coroner would certify that. So you can't certify an underlying death from something else, and that person didn't die of that. So that's not true.
Well, thank you for that, because I think there's all kinds of things going around, and sometimes people are wondering, if there's not some kind of nefarious thing happening in different places. There's always an opportunity, perhaps, for fraud, and there's always maybe a bad actor out there. But for the most part, that doesn't seem to be a trend at all.
No, and that person that's signing that death certificate, everything follows the same protocol. Wouldn't I don't think would put themselves at risk like that.
Right.
So obviously the person that's dying would, and if the certificate says of COVID-19, they probably died of COVID-19.
Yeah. Okay. Well, we're coming towards the end of our show, and so I just want to give both of you an opportunity to give a last word. Melissa, I want to thank you for coming on, and what would you like our viewers to know before we sign off?
That I just appreciate everyone listening and spreading the word on this mission. And anyone, if you want to have more information just to share on any of your social media or with people, please just reach out. And really, that's it. Thank you for listening.
And what is your web address again? I think
we'll put producealliance.com/produce boxes.
Good. That's on your screen there. Thank you so much. And then Dr. Singh?
Sure. So, by the way, Melissa's website will be on my webpage as well. So, if you guys need that, again, these are tough times. We've never seen this. This invisible enemy is taking a toll. Stay psychologically smart. Do some exercise. Be strong. This will pass. We will be stronger for this, and we'll be united from this. Don't live in fear. We're here. We're with you. We won't abandon you. And there's many ways of getting help through Heritage Church and elsewhere. Jeff, you probably could tell them about, if you need help, ask for it, and I'll let you talk about that.
Yeah, at our website, need help and get help and give help. Those two buttons are on our website, and make sure that you check that out at heritagechurch.com. I did want to make mention before we sign off, Dr. Singh, you've kind of focused your campaign more at serving the frontline people than you have been about trying to fundraise and do all those things. And there's a bunch of signatures you still need by the 15th and all that. So who knows where this campaign is going to go unless the governor and the state government step in and intervene on that. But I just want to thank you for there's a tremendous amount of risk that you're taking with regard to that. Do you have any thoughts, any comments?
It's tough. The government, because of that confinement, we were not able to complete those signatures. We have them. We were working very hard and diligently on them. We're confined, but it's hard to go and ask people for signatures. It's when they're scared. It's hard to go and campaign raise when they're scared. Our priority is the American public and it's the people. So we need to serve them. So whatever the capacity, it's not serving me, it's to serve them. And we'll do whatever we have to. Yeah. And that's what we're for. That's what we're built for.
I wonder, would it be beneficial for some of our viewers to contact the governor's office or maybe the senator's office or whatever and ask for some kind of a variance with regard to these signatures? Because I know like state legislators don't have to get signatures. They just file a $200 fee and they're on. But when it comes to U.S. Congress, then there's all these fees and all these who would they contact to say, hey, we'd like to see this provided because you didn't choose this?
No. In fact, we were making great progress, and we were invited to the fish fries and all elsewhere to get these signatures. We were getting the team actually, and that's when bang, the orders to stay at home in self-quarantine occurred, and the fact that you could call the governor's office, you could call the sitting congressional guys. But remember, this is affecting a lot of people. They're affecting judges, and they're affecting local and local mayors and aldermen and people that have to file for the election. It's affecting both the right and the left, and so everyone's affected by this. So the governor needs to really do something on this, obviously for multiple reasons. Even when these ballots are coming in. I mean, this is such an interesting time. Do you want to review this? Do you want to inspect this? Who wants to do this? The fact is, they prevented us from doing it electronically. We could get this done very quickly if it was allowed to do electronically. Right. And so we're caught between a hard place and a rock, and this is something new. So we had hoped that the governor would, reduce that and not just change the date. I think the fact that changing the date into May is not going to do it, because at the same point we're still quarantined. So we need to actually do something far more, like you said, maybe perhaps do a fee, file it online, and then let the American public decide.
Well, it's a unique situation, a unique time. It's going to require unique solutions, and she does have, and the legislature here in the state of Michigan do have the ability to do that. And I think for the sake of our democratic process, having multiple candidates, and this isn't a Republican or Democrat or independent issue.
Absolutely.
It's just for the House of Representatives. This is for senators. This is for judges. This is for across the board. And so if you have thoughts about that, maybe you should do some study on that and then contact the governor's office and others if you are the kind of person to make those phone calls or shoot those emails and see if we can't have some kind of a variance or a change in the requirements to be on the ballots for this year, because I think that's incredibly important. The game changed the day that the quarantine happened. And so every candidate is under the gun with this kind of thing. So, well, I want to thank you. We went just a little bit longer than we'd intended. I do want to thank you once again, and I've said this every time, this is not a religious thing or a secular thing. These issues are human issues. These are people issues. And so Melissa's organization, feeding the frontline people and feeding maybe sometimes the ones that are forgotten, the janitors and the security guards and the cleaners and all them, that's incredibly important. And then the masks, that's just a human issue. And so we just want to guarantee and make you feel comfortable. Anything that you give through heritagechurch.com for the COVID-19 relief, whether it's for food or for masks, 100% of that leaves Heritage Church. We won't keep any of it. We never do. We always give it away. And then if you'd like to make donations, physical donations of food, non-perishable items, we can receive those through our pantry. So I just want to thank you. I want to let you know and echo their statements that we're going to make it through this, and that Americans are creative and we find a way to push through these things. And soon, I genuinely believe that our government and our scientists and our leaders are going to find a way to defeat this and to get healthy, and then we're going to help the world get healthy. In the meantime, we're serving one another and taking care of each other. So thank you. God bless you. And we'll see you on another episode of A Doctor's in the House.
Thank you.